Fractional flow reserve was the first physiological index to be incorporated into routine clinical practice. In this technique, a vasodilatory agent, usually adenosine, is administered in order to minimize resistance in the coronary tree such that there is a linear relationship between pressure and flow. FFR is then calculated as the ratio of distal coronary pressure to aortic pressure, with a value of less than 0.8 being considered clinically significant. A number of studies held testament to the fact that the use of FFR could result in less PCI being performed and the safe deferral of PCI for lesions that were not hemodynamically significant. Despite this, the global uptake of FFR is relatively low. A number of reasons for this have been proposed. Firstly, there are a number of patients in whom the use of adenosine is contraindicated due to its potential to induce bronchospasm, and others who find the procedure particularly intolerable due to dyspnea. Additionally, the increased procedure and cath lab time combined with the added cost of adenosine precludes its use in many countries. So now many investigators want a time-efficient, inexpensive, adenosine-free, non-hyperemic index capable of interrogating the hemodynamic significance of an epicardial stenosis. Instantaneous wave-free ratio is a non-hyperemic index capable of assessing the physiological relevance of epicardial stenosis. It was derived from wave intensity analysis, which allowed the identification of a specific diastolic interval with a resting coronary resistance equivalent to that measured with the whole cycle. Averaged pressure measurements during hyperemia, as used for FFR but without the need for the administration of hyperemic agents. Research work demonstrated that values of non-hyperemic translesional pressure ratio obtained with this specific diastolic window correlated highly to those obtained with whole cycle averaged measurements during hyperemia, namely FFR. iFFR is a technique identical to making FFR measurements. A sheath is put into the leg, the pressure wire is passed distal to the stenosis, and it is normalized. While the same equipment is used, it is the software on the console that is different, and it uses special algorithms. iFR is developed and commercialized by Volcano Corporation. You can see the wave-free period, PA and PD, pressure over time in milliseconds.